Welcome to Social Work Updates. In this video, we are going to talk about the common models in social work practice. Social workers can use a variety of clinical theories in their practice, as well as specific therapeutic models. Although the theories may explain the reasons of a person's difficulties, practice models enable social workers to adopt particular techniques to address such difficulties. Cognitive behavioral model, crisis intervention model, narrative model, problem-solving model, solution-focused model, and task-centered model are some of the most popular practice models described in this video. Some of these techniques overlap or have similar qualities, but each has a distinct purpose for unique individuals and situations. Let's start with cognitive behavioral model. Cognitive behavioral therapy, or CBT, identifies harmful thinking patterns and attempts to change them. People frequently persuade themselves that their skewed views are correct. Individuals are forced to question and face their distortions as a result of CBT. For example, someone may be afraid of social events because they envision a worst-case scenario in which they will be humiliated. CBT encourages the user to question their preconceptions and investigate different circumstances and perspectives. CBT is generally beneficial to people who suffer from anxiety and depression, and many clinical social workers use it in their practice. The next model is the crisis intervention model. The crisis intervention paradigm is exactly what it sounds like. Social workers and mental health experts help in times of severe psychological strain or distress before the crisis becomes harmful. 7 steps to crisis intervention are proposed by Albert Roberts and Alan Ottens. These are follows: conducting a safety assessment, establishing psychological contact, identifying main difficulties, assisting the patient in exploring their feelings, looking for new coping methods, developing an action plan, and scheduling follow-ups are just a few of them. Clients with serious trauma, post-traumatic stress disorder, or suicidal ideation, among other issues, can benefit from the crisis intervention paradigm. Clients must be willing to participate in this style of crisis intervention because it operates on a voluntary basis. Next is the narrative model. Narrative model is founded on the idea that people tell tales about their personal experiences. In other words, they write their own life stories. This style of treatment is based on 4 fundamental principles. Number 1, there is no such thing as objective truth. Number 2, reality is a social construct. Number 3, language may impact how we perceive reality. And number 4, narratives can help us organize our personal truths. Narrative therapy enables clients to take on the role of narrator and rewrite the screenplay in order to remove themselves from their actual experiences. This can assist individuals in altering dangerous and disruptive thought patterns, particularly individuals shaped by trauma. We also have problem-solving model. In the 1950s, Helen Harris Perlman introduced the problem-solving approach for the area of social work. Many social work theories and therapies at the time depended on psychotherapy. Perlman claimed that focusing on one problem at a time would allow social workers to serve clients more effectively. Concentrating on fewer concerns allows customers to create and implement action plans to address those difficulties in a more manageable manner. This strategy is also known as partializing, would make therapies more manageable for both social workers and clients, and it is still used by experts. Solution-focused model. Solution-focused model, or also known as solution-focused brief model, focuses in a person's current and future circumstances. This treatment differs from psychodynamic-influenced ideas that concentrate on the past and childhood of an individual. Solution-focused treatment presents quick, doable solutions that help patients cope better with their issues. A mental health professional or social worker who uses this sort of treatment can ask a client to envisage their life without their problem in the future, or they might assist them understand and better utilize coping mechanisms that they already have. Solution-focused therapy may be used by social workers to help adolescents with behavioral issues or families with disputes, to mention a few examples. And the last model is the task-centered model. Many of the ideas of task-centered model are similar to those of the problem-solving model and solution-focused treatment, but it takes a more focused and rapid approach. Clients focus on accomplishing achievable goals during task-centered model, which usually lasts 8 to 12 sessions. Clients and social workers collaborate to build action plans with specified activities, which are subsequently carried out by the clients. This sort of therapy can be used in a variety of contexts by social workers. They may work with students who have disruptive behavioral concerns, hospital patients who are about to be discharged, or elderly clients in nursing homes. And that's it. Thanks for watching. For more social work updates, please watch and like the video, hit the bell and subscribe to my YouTube channel.